Dr. Fisher, would you kindly read the mission statement?
It's on the agenda at the top.
Thank you.
Dr. Martin, you're so adroit at doing this. I love how it's like the teacher back in high school who thinks you weren't paying attention. All right, so the statement: to improve the health and wellness of Nashville by providing equitable access to coordinated patient-centered care, supporting tomorrow's caregivers, and translating science into clinical practice.
Thank you. At this time, if anybody has a conflict of interest for any of the items being discussed, I would ask for you to disclose that. Hearing none, do we have anybody signed up for public comment?
No, sir.
Thank you. The minutes of the last meeting in October were distributed. You've had an opportunity to review. Do I hear a motion for approval of the meetings, the minutes of the October meeting?
So moved. Adoption of minutes.
And second.
Thank you. All in favor? Aye. Thank you. On to the standing reports. Because of a previous meeting and because this meeting is being started quite late, we're going to dispense with the formal reports. We will need to have another compliance meeting hopefully before the next board meeting, and we will receive those reports at this time. Christy Lewis will now present a summary of what is important for us to say and consider at this time.
Thank you, Board Chair. My name is Christy Lewis. I'm the Chief Compliance Officer for Nashville General Hospital. I do like to first thank all the committee members for submitting the reports, and they are incorporated in the packets that you have and will be reported in detail at a later date. I would like to inform the committee of the activities that have been occurring regarding surveys. There have been two major surveys that we have had. That were one that started in August and another one that started in December, to which we were able to lower the initial immediate jeopardy findings to conditional findings through a lot of perseverance, diligence, and hard work. We do want to inform the committee that we are waiting for the official 2567. That is the official CMS form that identifies all of the details, all of the conditions of participation that we need to address. In that, so therefore I recommend that this committee would please, that when we have an opportunity to report on the 2567 when it comes in, to be able to have that be the official findings that we will have to address. We have been also diligently working on those in anticipation of that. Once we receive the conditions, those 2567s, we will then have to respond in the form of a condition of participation. We will have 10 calendar days from receipt of the 2567 to provide a response. Nashville General has been working diligently in anticipation of that, and that will be our condition of participation will be our formal response to the 2567 that we are anticipating on receiving. Per the surveyor, we anticipate receiving that between February 10th and February 15th. And so we would like to make sure that all of the committee members are aware, and that we request that you will take this information to the board to have recommendations to adopt any of the actions that we will have in the plan of correction we anticipate that we will have a response by that time of that board meeting. That is the information that I would like to make sure is relayed and that is conveyed today. Nashville General continues to work. The overall goal is to be a high reliability organization, and that is exactly what we're doing with the work that we are doing today and moving forward. Thank you.
Thank you very much. And just reviewing this timeline, at the latest, we're supposed to receive this form and report by the 15th and respond in 10 days. So at the very latest, this would be the 25th of February, which happens to be the day before the board meeting. So unless they don't deliver that report in the time outlined, we should be able to consider that report and our response to it and be able to report that to the board on February the 26th. So I'd like to propose that we schedule another meeting of the Compliance Committee where we can hear the reports that everybody has prepared, and I apologize that they're not able to give them because of our time situation. But I would propose that we schedule a meeting on February the 25th of the Compliance Committee and ask Janet to confer with the members about the best time of day to do that. And then we will be prepared to present to the full board the findings and the plan of action for their consideration, endorsement, and approval, whatever the board would like to do. Any comments on that recommendation from me? Yes, Dr. Elders.
Just a comment about this team and for the minutes to ensure that timeline is captured. We have been talking about an ongoing Tennessee Department of Health survey that started August 18th. It exited officially November 26th. There was an additional survey on December 1st that exited January 7th. There was a revisit on January 13th that exited January 23rd. I just want that for the minutes to ensure that there's clarity on what our survey timeline.
Okay.
Thank you.
Any discussion of proceeding in the fashion that we've outlined here? Okay. Janet, if you would arrange that, appreciate it. And is there any further business to bring before the Compliance Committee? If not, I'd entertain a motion for adjournment.
So moves.
Second.
Thank you. Meeting adjourned.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information on this and other programs, visit nashville.gov.